Okay, we're going to go ahead and get it started with our final presentation of the day. And people online, if you can put a hello in the chat, if you can hear me and see the slides. Yep, fantastic. All right, thanks everybody. Okay, so our last presentation of the day is also going to be on radiology. However, we're going to talk about the exotic pets. So that will be fun. And then you can advance either using a touchpad here or these
the little
arrows.
buttons. Okay, beautiful.
Yep.
Hi, my name is Martha. I work in the exotics department here at AERC. Today I'll be talking about advanced radiology techniques for exotic pets. Briefly, I'm going to go over kind of all of the options for imaging for our exotic friends, knowing that most of them are not applicable to day practices because they don't have CTs and MRIs, but just so everyone is aware of all the different options that are out there for them. So our options, we have radiographs, either cassette or film. I included film. Is anyone still using film at their clinic? Okay, all right, just checking, sorry. We do dental radiography, ultrasonography, computed tomography or CT, magnetic resonance imaging or MRI, and then fluoroscopy. So I'll go through a little bit about each one and then dive into the main one, which is cassette radiography. Radiography, cassette or film, again, hopefully not film anymore. There's a high availability, so almost every day practice has a radiology machine to take x-rays. It's a relatively low cost for both client and clinic. Greatest familiarity, so technicians are taught how to take x-rays during school or even on the job training. They have the ability to produce 300 milliamperes in 0.008 seconds, most of the new machines, and that helps minimize any motion artifact with our species that breathe so fast. They do make radiology machines that have horizontal beam, and I'll go a little bit more into that in a slide here. One thing that we recommend is to place the cassette not in the tray, but on the table with some kind of protective surface over it. That gets your patient as close as you can to the cassette, and that will help the resolution of the image that you take. We have built a little kind of plexiglass cover, which I have a picture of. One other thing that we do at AERC is we sedate almost all of our exotics for x-rays. Most of the reptiles don't need it, but all of the birds, almost all of the small mammals, we will sedate them. Helps with stress. Your positioning is reliably better, so they can be reviewed by a radiologist if necessary, and it protects yourself and your patient from unnecessary time and radiology exposure. So this is a picture of our horizontal beam setup. So in the picture on the left, our cassette is back here, and it's being held up by this little machine here. Keeps it stable from getting damaged because it's expensive. And then our patient, we kind of have to use troughs and little foam wedges to get them high enough so that they're right in the middle of the plate. And then our actual x-ray will turn to a 90-degree angle, and then the beam will shoot across the table rather than down onto the table. And this is our little kind of homemade plexiglass cover that when we put it on the table, we'll put it over the cassette, and that keeps it safe from being scratched or getting dirty. All right. Oh. Is it supposed to have the question on it, or does it come up, Heidi, when they scan it? Says next animation. Do I do anything?
It's doing that weird thing again, isn't it? No, it's just, there we go.
Oh, there. Okay.
So now you can answer it.
Okay. Yeah, didn't do that last time.
No, I know. Did that for one other presentation too. There we go.
Interesting.
There we go. So now we'll be able to see it. Give them a few more seconds.
Okay.
Right, everybody answer? Okay.
Excellent. All right. So yes, it does help with the stress of the patient. It prevents repeat radiographs, and it definitely helps with positioning. So the only thing that doesn't help is our radiologists interpreting the x-rays. Dental radiography, we use it for very small exotic pets. So if there's like a 60-gram bearded dragon that comes in that needs x-rays, or a zebra finch that needs skull rads. We also use dental radiography for our post-extraction dental x-rays on mostly rabbits, but other species as well. Dental radiography is inexpensive, and most clinics already have a full setup for that for dogs and cats. We also have a portable x-ray generator here at AERC. Our dentistry, this kind of fun looking handheld piece of equipment. Our dentistry department used to go and take that to the University of Minnesota Zoo to take x-rays once they were done working on the zoo creatures. So now we use it so that we don't have to transport our anesthetized patients down to our actual x-ray machine. You can see we have our rabbit intubated, and we're able to get really nice clear images of their dental things and make sure that we got the full root out if we're doing any kind of extractions. Ultrasonography. So we use sound waves to create real-time pictures of soft tissues, typically for imaging the GI tract, urinary tract, and other abdominal structures. I did not get any good pictures of a patient actually getting an ultrasound, but I have a ferret ready for an ultrasound before the radiologist started. Very, very sleepy, very sedate. It's perfect. Computed tomography, or CT. So it's a beam of ionizing radiation opposite a detector that rotates around the patient. The 3 dimensions are then summated to produce a 2-dimensional image. This is an excellent thing that removes superimposed tissues, whereas cassette radiography, everything's kind of right on top of each other. Downsides, it's very expensive. It's usually only at large referral hospitals or universities, and typically requires moderate to heavy sedation to prevent any kind of movement. If we're doing contrast imaging, we do place an IV catheter. That also gives us the ability to give them fluids if we're doing contrast to help keep their hydration and their kidneys safe from that as well. If we are sedating for these procedures, we don't fast our small mammal patients. You can fast ferrets for a couple hours and birds for 2 to 3 hours, but typically everything else eats up until 2 minutes before we give them sedation. Here's some pictures of our patients in the CT machine. So we have this little contraption called the mousetrap, and the top comes off. We can give them oxygen. You can see our oxygen line kind of sticking into a port on the side. But this, because we don't fully gas and anesthetize them, we are always worried about having to walk away from them and leaving the room. So we put them in this little cage so then they can't actually jump off or injure themselves while we're not in the room, to make sure that they don't leave. But positioning is very important. You want to make sure that their head is nice and extended. Everything should be very symmetrical. And we have technicians who do this for us. We're very lucky because I can't make anything straight. But they do an excellent job at making sure our patients are perfectly level. Couple more pictures. So we have a hedgehog in there. And then this is how a rabbit kind of jaw will look like. So, and this is just one slice, but here's our sinuses, and here's our upper teeth and our lower teeth here. Here's 2 more images. This rabbit had a large abscess that is associated with one of its lower teeth. You would not be able to tell exactly where on X-ray it's associated with because everything is summated and right on top of each other. But in CT, it creates that individual images so you can see exactly where it's communicating with. And this is just a picture, sorry, with the of how it looks kind of while we're scanning. So each little line will go like this and take another image that turns out looking like this on the computer screen. MRI, downsides, like CT, availability, not most clinics do not have an MRI machine, cost and longer scan times. They do need to be gas anesthetized for MRIs. We've done 2 rabbits, and it took quite a long time. I don't know if anyone has ever had an MRI, but it takes quite a while compared to a CT. It does provide exquisite spatial resolution and gives you a really good assessment of brain and spinal cord if we're concerned about IVDD in rabbits or anything like that. Here's a picture from outside the MRI room. You can see our big machine in there, and then all the images kind of come through on this computer. There's only a few people, even at our facility, that know how to run the MRI machine, so it's very specialized. Fluoroscopy. So it's basically a moving radiographs. We keep our patients awake because we're trying to look at typically swallow studies or GI transit time. We'll put them in either that plexiglass mouse trap that we use for CT or some kind of box. It is higher cost, not quite as much as doing a CT or an MRI, and typically, again, available in large referral hospitals or universities. The other thing with exotics is we don't really have any normal values for them. So if we do this fluoroscopy, we're kind of guessing if it's normal or not. We've done a couple of swallow studies in rabbits, and it maybe showed that they were having some regurgitation, but again, we have no idea if that's normal or not. But here's a picture of what it looks like. So the fluoroscopy machine looks kind of like a C, and then our patient would be sitting right in here, and the beam would kind of come across this direction. And that is a little Myers parrot in there. And then I have a video of a rabbit. Let's see, how do I? No. Oh,
yeah,
there it is. Okay. So this patient was awake, and we fed it some critical care in a syringe with some barium, and then quickly fed it, ran away, and then took the image. So you can see it goes down into the stomach and then kind of comes back up again right after. Yeah. I dislike fluoroscopy. I think it's gross, but it's a really cool option, and I think something that will get used more in the future with exotics. Thank you. Beautiful. Oop, oh, okay. All right, so safety for radiography. So obviously for x-rays, time, distance, shielding. We've been pounded this into our head since we first started tech school or started at a clinic. So decreasing the time exposed to radiation and limiting retakes will decrease our exposure time. Distance, so utilizing troughs, wedges, and tape, we can be a little bit further away from the radiation. And then shielding ourselves with gloves, aprons, and even walls, if you can step that far away from your patient, will help. Proper positioning, sometimes sedation, will reduce number of retakes and rescans that need to be done as well. CT, if you are remaining in the room, you do need to wear a lead gown. You don't have to do that very frequently. Typically, humans leave the room during the scanning process. MRI, no metal within a certain distance. It can get sucked to the machine and cause damage, like very expensive damage. And always maintaining a safe distance from the machine while it's running. Fluoroscopy, as you kind of saw in the picture of the actual fluoroscopy machine, you want to wear a lead gown when the machine is running, and don't put your body kind of in the beam of that C. Oh gosh.
I think the only reason putting people's hands up is because I set it up as a quiz.
Okay.
It's like, oh, did everybody participate?
Got it.
You can go ahead and arrow ahead, and then
There we go. Okay.
yeah, and then
Okay.
people will still be able to answer it.
Beautiful. I'm gonna keep going. So, good job. Everyone got it right. Very proud. All right, so moving on to x-rays. This is kind of our main topic that you guys are all going to use in everyday life or work life. So in rabbits, chinchillas, and guinea pigs, using sedation to minimize stress and get excellent quality images is going to be really important. You can take all the same views as you can as a dog or cat, so abdominal versus thoracic, lateral versus ventrodorsal. You can do limbs, spinal views, skull views. If you are taking skull x-rays, important to get all of the different views of the skull, so lateral, oblique lateral, rostrocaudal, and dorsoventral. Their chest cavities are very small compared to their abdominal cavities. So if you are looking specifically at the thorax, it is ideal to collimate down to just the chest, so you get the best detail, best resolution. Likewise, if you're looking at the abdomen, get the chest out of there, focus only on the abdomen. But I also do what my doctor tells me to do. So ideally, you would collimate down to whatever you're looking at. For skull radiographs on these patients, if doing referral and doing a CT is not an option financially or physically, you can take these skull x-rays. They don't give you quite as much detail as a CT would, of course, but anything can help in the case of you having a sick patient. For the lateral, you want to make sure that you're both straight kind of like this way. Sorry, it's really hard to explain without using my hands. But you also want to make sure that if you're laying here, that your nose is not tilting down, because that will make some distance kind of interpretation. So using a foam wedge to keep their nose upright and in perfect parallel with their cheeks is very important. And then the oblique views, I'm going to show some examples also, but it's roughly a 45-degree angle that you're tilting it to, and that just helps separate the teeth roots so that you can tell which ones are looking normal versus abnormal. If there's an abscess, you can maybe tell which tooth it might be associated with. Otherwise, they're just right superimposed if you're taking just a flat lateral. Oh no, what did I do? There we go. Okay, so again, do as I say, not as I do. Doctor told me to do a whole body rabbit. So here we have a whole body rabbit. So you can see the spine and the, sternum are directly superimposed. Our pelvis is nice and lined up and symmetrical on each side. Bladder sludge problem in this rabbit specifically, but this is a good quality x-ray study to send to a radiologist. So here's some skull x-rays. So this is our, hold on, I'm going to go to the plain lateral first. So here is our right lateral. You can see the bullae here of the ears are directly superimposed on top of each other. You can see all of the teeth roots here, and then the incisors are nice and laid out here. For our oblique, it's a little small, but you can see one bulla is right here, and the other bulla is right here. So they are not directly superimposed. You can tell that it's a good oblique if you can see the independent bulla and they're not directly on top of each other. Here is our DV. This is nice and symmetrical. You can see kind of all the different parts of the skull. And then here are some chest rads on a guinea pig. So you can see getting down to the chest is possible. It's just really small compared to their abdomen, like 25% chest. Ferrets. Utilizing sedation, as mentioned, will provide excellent diagnostic images, thorax, abdomen, skull, limbs, kind of anything that they need, similar to cats for positioning. We don't do a ton of ferrets, so all I had for an example was a nice whole body x-ray. But you can see it's nice and lined up. The hips are slightly not superimposed, so that could be slightly better if we were going for a perfect x-ray. Rats and mice, sedation to prevent stress. Most of the images that we'll take of rats and mice are whole body just because they are so small, but we have taken just chest rads on a large rat per se if we were looking for metastasis of cancer or something like that. hedgehogs. So we can do abdominal, thoracic, whole body views, lateral, ventrodorsal. For the lateral views, it's ideal to try to move the spines away from the body. Otherwise, there will be some artifacts there. We'll typically use a big hair claw and kind of tip it under where the spines meet the body and then kind of pull it backwards gently. Again, they're sedated, so they usually don't care. It looks awful, but here's a VD of a hedgehog. You can see all its little spines along the outside. They're just so cute. And then here's another VD and the lateral, and you can just see the little bottom of our hair claw pulling away all the spines. All right, another question. Okay. Yay. Good job, guys. Tough. These are tough questions. All right. Sugar gliders. I don't have any good pictures, and I hate that because we do see quite a few sugar gliders. But for the most part, we do whole body views, but you can use dental radiography if you're needing one particular area. We've taken skull x-rays on sugar gliders using our dental machine. We've taken limb x-rays of sugar gliders if we're concerned about something fractured. Just gets us a little bit more better detail than using our big x-ray machine. Avian species. Sedation provides gold standard care, you guys. I don't know if I've mentioned that, but it's really helpful for taking x-rays. Again, lateral ventrodorsal views. The one thing that's different with our avian species is you can do what's called an H view in cases of traumatic cases. So a bird flies into the window, bird escapes for a couple days, they found it, comes in, but that will give you a better look at the bones kind of in the thoracic girdle area, make sure nothing's fractured. And then, as I mentioned, you can use dental radiography for limbs or small birds like skull x-rays or anything like that. When you're doing lateral positioning, and I'll show you some pictures, but you want to try to use foam wedges or towels to keep the hips superimposed on the x-ray. And then stretching the feet and legs caudally as much as possible, which you would think is easy, but for some reason they don't stretch as far as you think that they should. You can put a towel or a wedge between the wings when you pull it back to prevent the body from twisting. And then ensure that the tail is straight to the spine as well. So here's some pictures. Little African gray. So you can see this is our lateral view. So we've taped down the head and the neck area. We've taped the wings up kind of over their back like this. And then we have pulled the legs as caudally as we can and taped those down as well. And that's just directly onto our little homemade cassette protector. Same, that's the same picture as the one before. Sorry about that. And this one is our ventrodorsal view. So again, we've taped the head and the neck and then stretched the wings outward and taped those and then pulled the legs down as caudally as we can, taping those, making sure that we're superimposing the breastbone or the keel and the spine on our VD view. So this is how they look on the actual x-ray. So you can see our keel and our spine are in perfect alignment here, perfect superimposition. Our hips on this one are perfectly on top of each other. That was a little zebra finch. A little cockatiel. You can't tell what they are in x-ray, but I think it's fun to know. African gray parrot. So again, you can see our hips on our lateral are in nice alignment, and then our keel and our spine are right on top of each other. And this works for waterfowl as well. So this is a Pekin duck who needed some x-rays. You don't need to stretch their wings very much for a VD view, but you can see we've got the keel aligned with the spine. The hips and the pelvis are kind of exactly positioned so that they're symmetrical on either side. And then here's that lateral. And I can't tell you what you're looking at besides that it's a bird. So I'm not a radiologist. I don't know what I'm looking at. And then here's that H view. So when you're taking an H view, you need the horizontal beam aspect where you can move the head of your X-ray machine, but you tilt it at a 45-degree angle, and then the bird, I was gonna bring my bird and I forgot. So the bird's head is over here. You want to aim the beam this way towards the chest. So kind of coming from the head, going downwards toward the body. And that kind of isolates, you've got the clavicle, these kind of twisted bones here, the coracoid, kind of the semicircle in the middle, the keel going straight up and down in the middle, and then the scapula along the side. And so you can see we have a fracture here, which we didn't think that there was, but we took it anyway. And sure enough, there's a fracture. Just helps isolate those bones so you can better see them, make sure that there's no injuries to those. Another question. It's not as easy as the towel question. All right. So yes, the keel and spine. Nice job. All right, lizards. They're my favorite. So for lateral, ideally, we'd have a horizontal beam. Having the horizontal beam prevents us from having to turn them onto their side. They don't have a diaphragm, so all of their organs shift because it's just one big stack of organs. Everything shifts, interpretation becomes more difficult. You can place them in lateral recumbency, of course, if there's no horizontal beam available. But if there is, it's awesome. You can wrap them in a towel or wrap the legs away from the body in vet wrap. And I have a picture of that. It's ridiculous. For dorsiventral, you don't need to do typically any sedation. And again, small lizards like a 40-gram bearded dragon, you can use dental radiography. Here's a picture of a very well-behaved bearded dragon sitting on the table. And then it's coinciding radiograph. And here's the bearded dragon wrapped up. This was our old building, so we didn't yet have horizontal beam radiography. And so we just wrapped him up, flipped him on his side. He did great. These lizards, I tell you. But here's some x-rays. So this was using a horizontal beam. So we've got a leopard gecko. We've taken both DV and a lateral view. Got a tegu, also using horizontal beam. Chelonians, if you need their limbs and neck extended. If you're concerned about a fracture somewhere in a limb or something going on with the head or the neck, typically you would need to use sedation in order to get them to extend their legs out. You can do dorsal-ventral views, lateral views, skyline views, and again, horizontal beam is ideal. They're also a shell of organs, not so much a sac, they're a shell of organs, I suppose. But turning and tilting them, like other lizards, can severely displace organs. They also can have difficulty breathing if they are put in a position where their organs are pressing against their lungs. So here's a sedated turtle. it looks horrid, all the things we do to these poor creatures, but I promise you they're sedated. So we were pulling out their limbs and their necks so we can get really all of the bones that we were concerned about in the view. Here's a not sedated, so it's a little harder to see the limbs. You can kind of see them, but not great. Some horizontal view or horizontal beam lateral views. We have them stand on those little wedge foams, kind of what I mentioned before. Some people use like a box or like a roll of tape so that they can't push themselves off of it. Their legs just kind of hang. Another DV view, and then we've got this skyline view right here, and that can help us view kind of the lungs and some of the other anatomy a little bit better than a lateral or a DV can. So the skyline is the X-ray coming straight on from cranial to caudal rather than from the side. Snakes. I have no good pictures and I'm really sorry. I have one bad picture and it's a caution, like don't do that. But for snakes, we want to extend our snakes to be straight and label our images as we move down the body. So image 1 would be like head to mid body, depending on how big your snake is. And then the second would be, the second half of the body, however many views you need. You can do lateral, dorsiventral. Typically, you don't need sedation, but it very much depends on the temper of the snake and the breed species. So this is, don't do this, please. I'm going to show you an example with myself. So if someone, I'm off the camera, sorry. If I needed to get some x-rays of my chest, I'm standing here taking an x-ray, all of my organs are in their right place. But if I go like this, is my lung over here going to be in the right spot? No, it's going to be squished up. This one's going to be overinflated potentially because I'm using it more because this one is squished. So when we twist our snakes like this, it displaces where their organs are supposed to be. It can look different. It can lead us down the wrong line of thinking if we don't have them nice, straight, and extended. So this is, don't do this. But extend them nice and long, do 1 DV of each section, flip them on their side, do the laterals of each section, label them. Okay, last question. All right. Sedated and fully extended, please, ideally. But again, we do what our doctors tell us to do sometimes. I'm fully aware of that. But I do put up a little bit of a fight if he tells me something that I'm like, maybe we don't do that. Oh, I don't know what that is. Okay. That's all that I have. Do you guys have any questions? Yeah. Yeah. I typically do. So the question for anyone that couldn't hear was if you are taking x-rays of a snake, but you're looking at one specific area, would you still do the entire body? I suppose it depends. And it depends on the size of the snake too. Because like if you've got a 6-inch snake coming in versus a 7-foot snake, that may, even if you're looking at the lungs, that might be 3 images on the longer snake. So if you have a snake that you can fit most of it in, sure. If your doctor says, all I want is the lungs, that's what I'm concerned about, then I suppose you could just keep going until you reach the end of the lungs and then stop. So, but I can say that I have found things on x-ray that we were hoping not to find, and we weren't thinking down that line. Like I have found a bladder stone on a rabbit that we weren't expecting to find because I was trying to get just the chest and I didn't. So. Any other questions? Oh, I don't know. I'm useless in that capacity. Yes. Okay. What kind of tape did we use for avian patients? Oh my gosh. Okay. We have tried like 7 different types of tape. Right now, what we like the most is painter's tape. So like the little blue kind of thin frog, I think is one of the main brands that you use. But that tape seems to do the least amount of damage when you pull it off the feathers, but still holds it nice and tight.
Okay.
And then with exotics, yes, we do. So the question is, do you still aim for inspiration X-ray when you're doing chest rads on our exotics? And yes, the answer is yes. You do the best that you can. But if they're breathing at 90 breaths per minute, it's not quite as easy, but I try. I do my best. But yes, that would be the ideal. And same with abdominal X-rays, you would aim to take the X-ray on expiration.
Question? Okay, good job.
Beautiful. Thank you for coming. Oh, yeah.
I'll get your hair in there. All right. Thanks, online folks, for joining us today. Like I said, I'll get you your CE certificates within 2 weeks. Thank you. Have a good rest of your day.